My name is Joseph Bosson. I run Vermont Bean Crafters.
And we produce a line of value-added food products from local organic farms, ranging from bean burgers to falafel, bean spreads to cookies and muffin batters. Everything is bean-based. We focus on plant-based proteins, but they also involve local carrots, onions, herbs. So basically just taking foods that people are familiar with and relocalizing their ingredient palettes. We're also in the business of aggregating, cleaning, and brokering dry beans outright, just in 25-pound bags, and also pre-cooked beans for institutional and different specific custom processing. So the product we've been making the longest is our black bean burger. First ingredients, local organic black beans. We work with 12 different farms at different points. Everything that we opted into as an ingredient, we wanted to make sure that was either available year-round or we could put up, process, and freeze. We work with New England farmers because it's the only thing that seems reasonable or pragmatic to do. I initially wanted to grow things, but I realized what we needed more than more growers was more markets. And I had seen enough of the food system and been in enough kitchens to know that most of the things getting made in the name of food weren't what I would call food out there, whether we're talking restaurants, grocery stores, or institutional food service. Bean Crafters was about 5 years old when I had a family member that was doing a PhD in medicine and was fascinated to find out that they are now using beans in clinical treatment of diabetes. So all of this that felt like well-informed conjecture in the early years now seems to be gathering around this consensus around the role of plant-based proteins, beans in particular, in human health. And so for me, hospitals and being able to participate in the nourishing of people when they're in their time of greatest need, birth, death, recovery, that feels like a really heavy, auspicious role to have in the community. The nice thing about doing business with hospitals, at least from a business standpoint, is that it's consistent and robust. There's always people being born, dying, and getting sick. And we are able to lock in standing orders for the things that we do that give some structure and stability to other parts of our business that are otherwise more volatile. For me, Nourished by New England is kind of as good as it gets when it comes to beating ourselves at our current scale on as close to a local basis as we can.